This conference will now be recorded.
Good evening, students. I'm Dr. Divya. This is the last class of our fourth chapter. Okay, reproductive health. So we have learned about reproductive health. That means healthy reproductive organs with normal functioning of all those organs, right? So according to World Health Organization, reproductive health means what? Well-being in all reproductive aspects like physical, emotional, behavioral and social aspects. Okay. So a society with all these mentioned aspects like physical aspects and emotionally behavioral way and in all those physical, emotional and behavioral and social aspects. In all this way, it is going in a well organized way or it is in a good way or good manner. It is called as a reproductively healthy society according to WHO or World Health Organization. According to World Health Organization, society with all those aspects or in a well mannered way, all these aspects are going in a good way. It is called as a reproductive or reproductively healthy society. So the healthy people, they have healthier kids. If our reproductive health is good means definitely the society will be having next generation also in a healthy form or healthy kids will be there, right? And that makes a healthy family life, right? So they can contribute more to this society and community because there is no health issues like reproductive health issues and are not there means they will get a good generation. Next generation will be good and kids will be in good health. So there will be a good society also and reproductively healthy society. So that makes a good society and a good community also. So our reproductive system, it is a complex system. You know that it is a very complex system which is controlled by the neuroendocrinal system. So there is a combined process, right? So it is a very complex system. It is controlled by so many things, right? So it is a very complex. Reproduction means it is a complex process. So it's important and it's necessary to take discussing. Am I audible? Students, am I audible? Can you hear me?
Yes, ma'am.
Okay. So the diseases which are transmitted through sexual intercourse, they are called as, commonly called as, or they are collectively called as sexually transmitted diseases. in other names, like some other names also I taught, sexually transmitted diseases, STDs. Venereal diseases, VD. In short form, we'll mention as VD, venereal diseases, or reproductive tract infections, RTI. All these are same sexually transmitted diseases. Reproductive tract infection, like we used to tell, like urinary tract infection, respiratory tract infection, like that. This is reproductive tract infection. There is some kind of infection or disease for the reproductive tract. That those are commonly called as reproductive tract infection. They are grouped as reproductive tract infections. And we learned about some agents, some causative agents or pathogens which are causing sexually transmitted diseases. Normally, which are the pathogens or agents which are causing that sexually transmitted diseases are bacteria, then virus, chlamydia, then nematodes, ectoparasites, fungi. All these are the causative agents or the pathogens which are causing sexually transmitted diseases, or these are the agents or reason for the sexually transmitted diseases. So sexually transmitted diseases, how they are getting transmitted? How sexually transmitted diseases are getting transmitted? Sexual intercourse with an infected partner, right? With an infected partner, getting sexual intercourse means that may cause the reason. And sharing of injection needles. Sharing of injection needles, then surgical instruments, then blood transfusion. Sometimes organ transplantation, blood transfusion, all these causes the transmission of sexually transmitted disease also. If the person is infected, definitely through all these things, that disease also will get transmitted to the next person. Then from an infected mother to the fetus. So in all these ways, transmission of sexually transmitted disease is possible. Okay. So why I'm repeatedly telling this? Because see, there is no need of a sexual intercourse to get a sexually transmitted disease, right? Always we are going to hospital to take so many vaccines. Now for COVID we are taking vaccines, right? But we don't know. We never used to bother. We won't be bothered about how they are using that needles, right? If they are using the same needle for 2 or 3 people, definitely such kind of diseases will get transmitted. So we should be bothered about all these things. That's why through surgical instruments and needles, all these sexually transmitted, there is a chance of transmission of sexually transmitted diseases, right? So from an infected mother to fetus, then blood transfusion and organ transplantation, then sharing of needles and surgical instruments, then sexual intercourse with an infected partner. All these, in all these ways, there is a chance of transmission of sexually transmitted disease. Okay. So these sexually transmitted diseases, they caused by bacteria, fungi, and protozoa. All these can be treated with antibiotics and some other medicines also. So we can use antibiotics. Yesterday, while discussing about few diseases, we mentioned that there are some kind of antibiotic like penicillin for some diseases, right? So bacteria, fungi, and protozoa, these and all can be treated with antibiotics and some other medicines. Then some sexually transmitted diseases like hepatitis B. Yesterday we discussed hepatitis B, then AIDS. In the last class we discussed about these two, hepatitis B and AIDS. AIDS means acquired immunodeficiency syndrome. So for these which are caused by virus, we cannot treat with such antibiotics. But we can, or the symptoms which are appearing, that can be brought into control by antiviral medicines. Only that much we can do for such kind of diseases, which are all hepatitis B and AIDS. All these are viral diseases, but there is no treatment, proper treatment for this kind of diseases. But for hepatitis B, vaccination, prevention we can do. Preventive vaccines we can take. But in the case of AIDS, there is no proper treatment, but the symptoms can be controlled or brought into control by antiviral medicines. So in these sexually transmitted diseases that show some kind of symptoms, right? During that incubation period, that shows some kind of symptoms, stage by stage symptoms that shows. So the early symptoms or the symptoms in the starting stage, that may be simple or that may be in minor level, right? In the starting stage, simple symptoms that shows. So in that initial stage, the symptoms like itching in genital region, then some kind of fluid discharge, all these occurs. Then sores or the bumps on the genital area or the rectal area. Then some kind of burning sensation or some kind of pain while urination. Okay. Then vaginal discharge, unusual vaginal discharge and vaginal bleeding. Then pain during intercourse. So all these are the common symptoms, starting stage symptoms of sexually transmitted diseases. So once in one person, that main problem, what is the main problem in common people? See, if a person is infected like this, I said there are so many reasons for this infection. Then it is a sexually transmitted disease, but there is no need of a sexual intercourse to get this disease. There are so many other reasons. Okay, like I said, organ transplantation, that also cause. That may be the reason, or sharing of surgical instruments. That may not be our fault. Okay, due to that surgical instrument sharing or needle sharing, due to all these, people can get this kind of sexually transmitted diseases, right? So one main problem is that most of the infected person, if it is a female person, mainly they will be asymptomatic, or there is a less chance of symptoms or late symptoms. Symptoms will develop very late. Okay. So during all this period, what they will do, they may remain quiet or they won't be detected for a long time. Or in some cases, they won't give much significance for the symptoms. Okay, in early stages itself, we can find out the infection and we can solve the problem, right? But in some cases, some people, they won't give much attention towards these symptoms, or they won't take it as an important symptom. They will leave it like a silly problem. So such kind of infection, why mainly they are doing? Because the society is like that. If some people are like, somebody is reported like they have some sexually transmitted disease, definitely they'll start blaming, right? They'll keep on commenting. So that kind of people are shy actually to think this is a kind of reporting such kind of symptom. It is a shame like that. The mentality of society is like that. So they usually neglect or they will avoid reporting such symptoms instead of taking the treatment. So later, it will lead to complications, especially in females, and this may cause stillbirth, infertility, abortion, and finally, some cases it may lead to cancer also. So STDs are, or sexually transmitted diseases, are major threat to a healthy society. Okay. So for the prevention of this early detection and curing this disease, that we need to give prime consideration. That is the important solution for this. So all persons, all persons are vulnerable, or each and everyone, there is a chance of getting this disease and such kind of infections. And especially in the people in the age of 15 to 24 years, means in their teenage, such people, there is a chance or they are more prone to this kind of diseases. So to prevent these diseases, whatever we should do, avoid. The common way to prevent this disease, what is that? Avoid sex with unknown partners. Then always try to use condom during coitus, especially latex condoms that reduces the risk. Then in case of doubt, like if anyone is having some symptoms and they're getting a doubt like they have some kind of infections and some symptoms are found, they should go to a qualified doctor for early detection and they should complete the course of treatment if diagnosed with the infection. Okay. The main laboratory test to confirm STDs are bacterial culture. The main test, note down main tests which are bacterial culture, blood or genital swab are collected for this kind of culture. Then microscopic observation using staining technique. Then urine test for some diseases like chlamydia and gonorrhea. Gonorrhea we have already discussed. Chlamydia I'm going to discuss today. Then some kind of serological test. ELISA. Yesterday we discussed about this ELISA. Enzyme-linked immunosorbent assay. It's an antigen antibody test. And for AIDS and hepatitis and all, we are following this test. Then another one is polymerase chain reaction, PCR. So nowadays, PCR test is done for COVID detection, right? So such PCR, polymerase chain reaction. For this, we are doing DNA isolation, then some kind of buffer and all we are using. With that, polymerizing, that DNA polymerization. With a little sample, we are making hundreds and thousands of copies of DNA to detect the disease. Okay. Which one? Which virus? That COVID virus. It is a RNA virus. Okay. It's a RNA virus. That's why we are doing RT-PCR. Okay. And yesterday we discussed about few diseases like syphilis, gonorrhea, then which are AIDS and all we discussed in the last class. So mainly you should note down the symptoms, diagnosis, then treatment, incubation period, medicines. Medicines which are mainly used. This and all will come for NEET examination. NEET exam questions will come from this area like diagnosis, symptoms, treatment, incubation period, then the pathogen. Okay, then medicines and all you should note down. Then today we are going to start with the disease called genital herpes. Okay, genital herpes, it is a viral disease and it's a sexually transmitted disease, and the pathogen or the disease causing agent, that is herpes simplex virus, HSV, herpes simplex virus. Okay, so the symptoms of this disease, they are first that will form a formation of lesions like vesicles or pustules. Okay, formation of lesions like vesicles or pustules. Then later it forms cluster of painful erythematous ulcers. Okay, what do you mean by erythematous ulcers? Erythematous ulcers means abnormal redness. Okay, not from normal color, it will form abnormal redness or reddish color of skin. Skin will become reddish, abnormal red color due to the accumulation of blood capillaries. Okay, blood in that blood capillaries. That surrounding area, blood capillaries will be filled with blood and blood will accumulate in that area and that will become reddish. Okay, abnormal redness in that area. So such painful ulcers, now ulcers are already formed, and these painful ulcers, where they will form? They will form near genital region and perianal region. Genital region and perianal region, this kind of painful ulcers which forms redness of that skin. Okay, and this will be very painful. It forms as clusters. But in females, that severe symptoms are seen in normal cases. So in the case of females, the symptoms will become severe. Okay. So in an infected female, from that female, the newborn babies also will get infected. That means from mother to baby. Okay. So from mother to baby, this infection will pass very easily. And this infection is followed by headache, then fever, then vaginal discharge. All these things will be present in female. In female, we can see vaginal discharge, abnormal vaginal discharge, then fever, headache. Then from an infected female, that baby will get very easily. Okay. So genital herpes, it's a viral disease And the causative agent or the pathogen is herpes simplex virus. Herpes simplex virus, HSV. Okay. And the symptoms, there are many lesions which resemble vesicles or pustules. Okay. First, it will form pustules, then that will be followed by cluster of painful erythematous ulcers. This is followed by painful ulcers which are forming redness in that area. Okay. Then where it will form over genitalia and perianal regions. In genitalia and perianal regions, such kind of ulcers, painful ulcers, which are erythematous. Okay, such kind of ulcers will be formed in the genital area and perianal region. So symptoms, these symptoms are more severe in the case of female. Okay, in female, these kind of symptoms are more. Infection of neonates, newborn babies that can occur in the case of infected female. If a mother is infected, definitely a newborn baby will get infected or the chances are more. And accompanied by this, after this ulcer formation, this painful ulcer formation, that will be followed by fever. There's a chance of fever, headache, then pain, then itching, and vaginal and urethral discharge along with swelling of lymph node. That surrounding area lymph nodes will be having swelling, and there is a discharge of vaginal and urethral discharge, then itching, then pain, headache, fever. All this will start slowly. It will start during the incubation period. Then infection of the urethra and cervix, that also may occur. Okay, urethral discharge and vaginal discharge occurs, and there is a infection, chance of infection also in the case of this disease. Okay, right? And here you can see in this picture, this is how pustules will appear, and you can see some kind of redness in this area. Here you can see, and this will become more severe during the incubation period. Okay, it becomes severe, and this ulcers will become more painful during the incubation period. And next disease is genital warts. Okay, genital warts, and in this the causative agent is a virus. Again, here also this is a viral disease. And which viral pathogen is causing this disease? Human papilloma virus. Human papilloma virus is causing this genital warts. Genital warts, the disease or the agent of this disease or the pathogen is human papilloma virus. HPV, short form is HPV, human papilloma virus. And this warts, that is like a small tumor. It will appear like a small tumor and with hard outgrowths. It will be having hard outgrowths. Okay, genital warts. This is like small tumor-like appearance will be there, and it will, that outgrowth, it will be very hard. And they'll be having horny type surface. The surface will be somewhat like horny type, and that develops all over the skin of the genital area. In the genital area, they will develop all over the skin, and it is having a hard surface, and that develops on the mucosal surface of external genitalia. Okay, and that develops in the perianal area also. In the perianal area and the mucosal surface of external genitalia. In both parts, this will develop. Okay, but in the case of female or in the case of women, that infection may lead to vaginal and cervix also. That may lead to vagina and cervix. There also it will get infected. In the case of women or in the case of female, that infection may lead to vagina and cervix. And This will lead to vaginal cancer and cervical cancer also. Sometimes that may lead to this vaginal and cervical infection may lead to cervical cancer and vaginal cancer also. So if it is not treated in a proper stage or it is not detected in the early stage, that may lead to vaginal as well as cervical cancer. So through DNA hybridization and culturing, then antibody detection, DNA hybridization, culturing, and then antibody detection. These are the method of diagnosis of this disease. Okay. Then wart removal. That is the best solution or treatment for this. Okay. Wart removal. Removal of this genitalial wart. Okay. The genital warts can be removed. That is the best method for the treatment of this disease. So that need a surgical skill. Mainly the internal wart removal needs special skills. Okay. So cryosurgery is used to remove this kind of warts. Cryosurgery for removal of internal warts. Cryosurgery is used to remove these warts. Then a plant. Here you can see the plant. This is called Podophyllum. This Podophyllum peltatum. This plant is called as Podophyllum peltatum. It is called as ground lemon. Common name is ground lemon. So this Podophyllum plant, these preparations from or extracts from this plant that is used for wart removal. Okay. These preparations are made mainly from the dried root. The dried root and the rhizome of these plants. So mainly the extract is prepared from the dried root and the rhizome of these plants that is used for the wart removal. So Podophyllum, it is Podophyllum peltatum. That is the plant and extract of these rhizome and dried root. Extract of these dried root and rhizome of this plant Podophyllum peltatum that is used for wart removal. And the common name of this plant is ground lemon. Okay. And here you can see genital wart, the causative agent or pathogen is human papilloma virus HPV. And the symptoms are warts which resemble small benign tumors with hard outgrowth and horny surface. The hard outgrowth and horny surface. That is the appearance of this warts. And it will develop all over the skin and mucosal surface of the external genitalia and perianal region. In the mucosal surface of the external genitalia and perianal area, this warts will develop. And in women, the infection may enter vagina and cervix. In the case of female, that infection may enter to vagina and cervix also. And this may result in cervical and vaginal cancer. If it is not treated at proper stage and in proper way, that may lead to vaginal cancer and cervical cancer also. Then diagnosis. Diagnosis, antibody detection. The method of diagnosis is antibody detection, then culturing and DNA hybridization. In all these ways, we can diagnose this genital warts. Then treatment. How we'll treat or how the treatment is done. Removal of wart. That is the best method. Removal of this wart. Then that requires special surgical skill, especially for the removal of internal warts that need special surgical skill. So cryosurgery that is used to remove the warts. Through cryosurgery, one infected person can remove the wart. Then podophyllum preparations are used for the removal of the warts. Podophyllum peltatum, preparations of this plant. That means the preparations from the dried rhizome and roots that may help in the removal of this genital warts. Clear? Then here you can see the genital wart, how it is appearing. The rough horny surface of the genital wart, external genitalia. Here you can see. Here, in the case of male, it's appearing in this kind of areas or region, and in female, You can see here, in the case of female, it will be like this. It is caused by human papillomavirus. Okay. And next disease, it is chlamydiasis. Chlamydiasis in this agent, the causative agent is Chlamydia trachomatis. Chlamydia trachomatis. That is the causative agent or pathogen. And the symptoms are in Chlamydia trachomatis, it is a human pathogen that we know it is a human pathogen and it is causing perinatal infection. Perinatal infection. It is causing perinatal infection and this is an obligate parasite. The main point is the chlamydiasis. In chlamydiasis, the causative agent Chlamydia trachomatis, the pathogen, it is an obligate intracellular pathogen. It's an obligate intracellular pathogen. We have already learned what is obligate parasite. What do you mean by obligate pathogen? Means without that host, without that particular host, the life cycle of that pathogen will not be complete. So to complete the life cycle of that pathogen, that need a particular host. Okay. So without that host, that can complete the life cycle. And it's an intracellular parasite. Okay. Intracellular parasite. And this causes epididymitis, then with unilateral scrotal pain. The symptoms include unilateral scrotal pain. Scrotum, the covering of the testis, it is called as scrotum, right? We have learned in the last chapter about reproductive organ. When we learned that time, we learned about scrotum. So scrotum, that covering of the testis, then tenderness and swelling of that area. In that area, swelling will be developed and tenderness of that area. Then rectal pain and mucus. Then occasional bleeding also. So these are coming under the symptom of this chlamydiasis. So in chlamydiasis, the causative agent or the pathogen, it is Chlamydia trachomatis. Chlamydia trachomatis, note down, Chlamydia trachomatis, it is an obligate intracellular pathogen. Chlamydia trachomatis, it's a human pathogen that causes trachoma and this, it is sexually transmitted and that causes perinatal infection. Then this obligate intracellular pathogen, obligate parasite or obligate pathogen means without host that cannot complete the life cycle. Okay. So that causes urethritis epididymitis, means inflammation of the urethra and epididymis. Okay. Then with unilateral scrotal pain. Scrotal pain, scrotum, you know. So the scrotal pain that causes the scrotal pain, then tenderness and swelling. Then mucopurulent with yellowish mucus and pus. Then cervicitis, inflammation of cervix. Then inflammation of the fallopian tube. Then proctitis, that means rectal pain with mucus and occasional bleeding. Proctitis means rectal pain, pain in the rectal area with mucus and bleeding also occurs. Okay. Then diagnosis. How we can diagnose this disease, chlamydiasis. Clinical symptoms, by clinical symptoms, then gram staining. Gram staining, yesterday we explained what is gram staining. It's a staining method. Okay. By staining, by using the discharge. Then antigen detection and nucleic acid hybridization. Antigen detection, then nucleic acid hybridization. The incubation period of this disease is around 1 week. Incubation period is around 1 week. Then treatment. Which are all the antibiotics? Antibiotics like tetracycline, then erythromycin and rifampicin. Okay, all these are effective. But penicillin, here note down, penicillin is not that much effective in treating chlamydiasis. Okay, penicillin is not so much effective in the case of chlamydiasis. It won't work out so much. Okay, so note down penicillin is not so much effective. These are all neat questions. Penicillin is not effective in the case of chlamydiasis. Okay, next. Chlamydiasis, which is infecting the genital area. Next is trichomoniasis. Trichomoniasis, this is sexually transmitted disease which is by protozoa, which is caused by protozoa. STDs caused by protozoa. First one is vaginalis. The agent or the pathogen is Trichomonas vaginalis. Note down. Then the symptoms. Symptoms include in female that cause vaginitis. Okay, but in male that shows some different kind of symptoms. The symptoms, it is different in male and female. Okay, in female that causes vaginitis, and vaginitis means there will be vaginal discharge and burning sensation will be there, and that vaginal discharge will produce a foul smell and that will be yellow in color. So yellow color vaginal discharge which is having foul smell, then burning sensation in that area. Okay, these are the symptoms in the case of female. But in male that causes epididymitis and prostatitis that resulting in pain and burning sensation. In male also they will be having burning sensation in that area. Then that causes urethritis, epididymitis and prostatitis. This result in the pain and there will be some kind of burning sensation in the case of male. So that shows different kind of symptoms in male and female. In female that causes vaginitis, means infection, in vaginal infection that causes, and that is causing vaginal discharge, that causes a vaginal discharge which is having yellow color and foul smell, and this forms a burning sensation also. But in the case of male, urethritis, epididymitis and prostatitis, this result in the pain and burning sensation in case of males. And diagnosis can be done by clinical symptoms, then microscopic examination, then culture and immunofluorescent antibody staining. Okay. So diagnosis. Trichomoniasis in both male and female, it shows different symptoms. Okay. By clinical symptoms and microscopic examination, then culture and immunofluorescent antibody staining. With all these, we can detect the infection. Then treatment. Metronidazole. Metronidazole that should be given to both partners. Simultaneously, both partners should take the treatment with metronidazole. Okay. This medicine should be used by both partners simultaneously. Then next is another STD which is caused by protozoans, amoebiasis. In this, the pathogen or the causative agent is Entamoeba histolytica. See, these are normal infections, but sometimes it may get transmitted through sexual contact also. Okay, this may get transmitted through sexual contact also. So the presence of blood in stool and feces, that is the important symptom. Presence of blood in stools and feces, and the transmission of this Amoebiasis, it is mostly through oral route, but sometimes that may happen through sexual contact also. Okay, so the diagnosis can be done by stool test, then clinical symptoms, and the treatment, anti-amoebic tablets are given to the patients. Okay, so the patients are treated with anti-amoebic tablets. And amoebiasis, it's a sexually transmitted disease which is caused by protozoans. Mostly these are through oral route, transmitted through oral routes, but sometimes it may cause through sexual contact also. And clinical symptoms and stool tests. With those, we can diagnose this disease, amoebiasis, and the causative agent or the pathogen is Entamoeba histolytica. And the treatment, anti-amoebic tablets are given to both all the patients. Okay, to treat this, anti-amoebic tablets are given to the patients. Then next is giardiasis. This giardiasis, the causative agent or the pathogen is Giardia lamblia. Giardia lamblia, that is the causative agents. I know it's difficult to learn all these pathogens name, but daily just note down the pathogen and the disease. Minimum you should learn that much from the sexually transmitted diseases, because you may get 3 to 4 questions from this area for your NEET exam. So it's better to learn, make it as in a table format, then write down the disease, the pathogen, incubation period, and the medicine. If medicine name is there included, that medicine also you should note down. Then the treatment. Make it as in a table format and read once or twice. So within a week, you can learn. At least you can recollect by seeing the options, you can recollect that. So that is the easiest method. This you have to by heart. There is no other option. So the STD caused by protozoan, giardiasis, the causative agent is Giardia lamblia. And the symptoms. This pathogen lives in human intestine. Okay, that is an intestine, the pathogen which is lives in human intestine. And this, what this pathogen will do, that interfere with the digestion and absorption process. When the food is getting digested and absorbed, or during absorption, this pathogen interfere with this digestion and absorption process. So epigastric pain, then diarrhea, then sometimes it may lead to fever also. Diarrhea, headache, then abdominal discomfort, some kind of abdominal pain and discomfort, then epigastric pain, then headache, and sometimes fever also may develop due to this infection. Then diagnosis. Normally, this can be diagnosed through clinical symptoms, then stool test and clinical symptoms. So mostly it is caused through food contamination or contaminated food consumption, or consuming this contaminated food. That may be the reason for this disease. But sometimes through sexual contact also this disease can be transmitted. Okay. So normally this is caused through contaminated food, but sometimes sexual contact also may be the reason. Then clinical symptoms and stool test. Both, with this both we can diagnose the disease. And the treatment. Here, say the anti-amoebic tablets are given to the patient. Okay. So this is a pathogen which is living in human intestine, which one? Giardia lamblia, that causes giardiasis. Okay. And in such diseases, it is easy to find out the pathogen. There is a similarity between the giardiasis and Giardia lamblia. We can find out the pathogen easily, but the symptoms and the, it's a human intestine pathogen which lives in human intestine, and that is interfering with the digestion and absorption of food. Okay. Then definitely the digestion and absorption of food, that pathogen is interfering. These two means the symptoms. Further symptoms will be related to that, like epigastric pain, then there's some kind of discomfort in abdominal area, then diarrhea, headache, and this leads to fever also. Okay. Next is enterobiasis. This is here, it is caused by nematodes. And while making table format for studying this disease, note down viral disease. First, you have to list out viral disease, bacterial disease, then nematodes. Like that, you have to make categories. Okay. Then you need to make it in a table format and read. Then enterobiasis. Enterobiasis, the causative agent or the pathogen is Enterobius vermicularis. This is commonly known as pinworm. It's a pinworm. Pinworm, the scientific name is Enterobius vermicularis. Okay. And the symptom means, what are the symptoms of this disease? Intense itching at the anus. In the anal area, itching. And the external genitalia, there also some kind of itching will be there. Then inflammation of membrane of colon and appendix. Then nausea, abdominal pain, and diarrhea. Okay. So enterobiasis, the agent is Enterobius vermicularis, commonly called as pinworm. Enterobius vermicularis is commonly called as pinworm. Okay. And the diagnosis. So the infection is mainly through fecal-oral route. So where the patient scratches the area and the egg that are under person's nail, and that may infect others. Okay. That's why that's how it's getting infected. And the transmission, that sometimes it may get transmitted through sexual contact. Okay. And the treatment, anti-helminthic tablets. Those tablets are recommended for this disease, pinworm. Okay. Causative agent for enterobiasis, causative agent or the pathogen is Enterobius vermicularis, and the treatment, anti-helminthic tablets that are recommended for this disease. And how it is getting transmitted? When the patient scratches, see, intense itching in the anal and external genital area, that is the symptom. So definitely the patient will be having a tendency for scratching that area, and while scratching, those eggs laid by this pinworm, that will come into this person's nail, and that causes the infection to others. Okay. So anti-helminthic tablets are recommended for this kind of diseases. And next is sexually transmitted diseases caused by arthropods. Scabies. In scabies, the causative agent or the pathogen is Sarcoptes scabiei. Sarcoptes scabiei. And the symptoms include itching, intense itching, severe itching, and crusty patches on the skin, which increases and spreads as the mites burrow deeper into the skin. Okay. So itching and crusty patches on the skin, that increases the spreading. Okay. And the treatment include scabicides, and these scabicides, usage of the scabicides, that is coming under treatment. And these scabicides are available in the form of creams and lotions. Scabicide, which is available in the form of creams and lotions that are used for the treatment. Okay. So scabies, the causative agent is Sarcoptes scabiei, and the symptom is intense itching and crusty patches on the skin, that increases the spreading. Okay. Which is that will spread into deeper skin. Okay. And the scabicides, which are available in the form of lotion and creams that are used for the treatment of this disease. Next is pediculosis. Okay. The causative agent, pediculosis, these are caused by arthropods. These are coming under disease, STDs caused by arthropods. Then second one is Under this, pediculosis, this is caused by the causative agent of the pathogen is Thymus pubis, which is commonly called as pubic lice. Pubic lice. And the symptoms. Symptoms means the painful itching and red patches in the skin. In the pubic region, that is the point. In the pubic region, painful itching and red patches will appear. And that lies this pubic lice that lays egg near the base of the pubic hair. Okay, that is the important symptom that Thymus pubis, this pathogen lays egg which is near to the base of the pubic hair, and the young one that will hatch with a few days. Okay, so within few days these eggs which are near the base of the pubic hair, the young that will hatch within very few days, and that will become more severe infection. And this kind of infection that will spread by sexual contact also, by sharing bed sheets, clothes, towels, etc. Okay, by sharing the bed sheet, cloth, towel, then through sexual contact also. This disease can be transmitted from one person to another person. Then medicated shampoos are recommended, or mainly for the treatment of this disease, medicated shampoos are used. Okay. Next is sexually transmitted disease which is caused by yeast or fungus. Okay. Candidiasis, that is the sexually transmitted disease caused by fungus, and the causative agent of the pathogen is Candida albicans. Candida albicans, which is commonly known as vaginal yeast. Okay, Candida albicans is commonly called as vaginal yeast. And symptoms of this disease, that infection mostly that infects mouth, colon and vagina. This Candida albicans is commonly called as vaginal yeast. Okay, so that infection mostly that infects mouth, colon and vagina. So in women or in female, that infection creates painful inflammations of vagina, and often there will be a vaginal discharge which is very thick and cheesy type. There is a vaginal discharge of thick and cheesy type. This creates painful inflammation in the vaginal region, and that painful inflammation that will develop in urethra. In urethra also this will develop through sexual contact with an infected woman. Okay. In man, okay, in the case of male, that will develop inflammations in the urethral region. How it will develop? Through sexual contact with an infected female, it will develop painful inflammation in the case of male or man. Okay. So the infection that mainly in the area of mouth, colon and vagina. In the case of ladies or in the case of women, that Candida albicans infection that cause painful inflammations, and there is a vaginal discharge in the form of thick cheesy discharge from vagina. Okay, and if a sexual contact is happening in between a infected female and a male, a normal male, that infection will pass to the male also. And how it is getting treated? Antibiotics like clotrimazole, then miconazole and nystatin. These are the treatment. Okay. So the antibiotics which are used for the treatment is clotrimazole, miconazole and nystatin. These are the antibiotics which is used for candidiasis, which is caused by Candida albicans. Okay, it is commonly known as vaginal yeast, and this is the common infection. So in women that causes vaginal discharge, thick cheesy discharge, and the sexual contact with such infected female may cause the infection in male also. So antibiotics like clotrimazole, metronidazole, and nystatin. These are the 3 antibiotics which is used for the treatment of this disease. Is it clear? So that's all about sexually transmitted diseases. Is it clear? You want me to repeat any other portion, like any disease? Or is it clear? Do you have any doubt in this? Deepa and Gunashelvi, right? You want me to repeat anything? Do you have any doubt?
No, ma'am.
Okay, so hope everything is clear. So I'll share the questions also, go through that, practice those questions. Okay, so that's all about reproductive health, chapter 4, reproductive health. Okay, thank you. You can leave.
Thank you.